Yeah, all good. Thank you. Um, First of all, it's a pleasure to be part of the International Dental uh, Dentistry and Dental Materials. Thank you, United Research Forum, to having me to have me here today. Uh, so, First of all, my name is Dr. Sonish. I'm a dentist from Fiji, and I work in a government facility in Ministry of Health. My topic today is on implementation of low-cost teledentistry with low resource settings during the COVID-19 pandemic in Fiji. This is back during in 2019 and 2020. Yeah. Next slide. So first of all, Fiji is located on the right side of Australia and New Zealand. You can see it on the map where it's written Fiji. It's a really small island, but it's a really beautiful place. Next slide. So some of the things that Fiji is famous for is its Bula smile. Bula is a Fijian greeting in Fiji, like how you say hello. So we say Bula in Fiji. Some of the things that it's famous for, other things it's famous for is Fiji water. You might have seen in a few TV series or movies. Um, they consume Fiji water. You can see Johnny Depp holding a Fiji water bottle. Also Fiji Gold, which is a beer, a good thing to enjoy at the beachside. Fiji has beautiful beaches. Next slide. So this is our Singatoka hospital team. It's a mix of doctors, nurses, and dentists, and dietitians, and physiotherapists. It's a small hospital. It's a subdivision hospital. So, yeah, next slide. And this is our dental clinic. It's a small dental clinic, quite old-fashioned, you might say. Uh, Sometimes, I mean, most of the times we are under-resourced. And as you can see, the reception area on the upper left side, we are still on the manual system. And of course, as you can look at that, the files of folders, we are still in the manual system. We haven't transitioned into digital dentistry like the rest of the world. So this is that's the 3-chair, and it's the sterilization room on the at the bottom and the middle, and on the lower right you can see our dent. Next slide. Next slide. So I published after doing this pilot and implementing the teledentistry. I published a letter to the editor. We tried to publish as a journal, but I think it has been implemented in a lot of countries. And well, this is a concept that we took from other countries and tried implementing here. So it's a small letter to the editor we published in Asia Pacific Journal of Public Health, and it was quite a proud moment. Some of the economical and population-based to world the World Bank, you can see on the right. Fiji has quite a low life expectancy, and it's a small population, less than 1 million population. And as you can see, the net migration is in negative. So we have a lot of emigration than immigration. Next slide. Another thing that this is from the Asia Development Bank. In terms of the poverty rate in Fiji, it has been rising before even the pandemic, and the basic needs of poverty rate has increased to 9.9% in 2019 to 2020. And at current rate, it says that Fiji is unlikely to meet its 2030 Sustainable Development Goals poverty reduction target. I'm telling you all this so that we have a bit of a background on understanding why we implemented a low resource and low cost on teledentistry. Next slide. So teledentistry is basically a branch of telehealth and telemedicine, which is devoted to oral health. And telemedicine is providing health services remotely where there is maybe geographical barriers or conflicts or pandemics like COVID-19, like in our case. Next slide. So evolution of teledentistry has gone quite far. It was first introduced in 1994 by the Total Dental Access Program. This is for US Army. So they basically basically created a program where they were able to communicate with the specialist to triage their patients and check patients' health status from the specialist before treating patients for oral health. Now everyone's in digital workflow, and it has advanced into apps which you can access through mobile. Some of the teledentistry also are the Smile Direct Club, which is direct to consumer orthodontics. You may have heard of it. Some orthodontists are really against it because it's not really a proper channel where patients get a thorough assessment. So while I agree to that, it is still available to the public. Next slide. So in Fiji, we used Viber. Viber is something similar to WhatsApp, more popular in our side, the South Pacific side. We use Google Forms and Google Calendar. And Viber, it has end-to-end encryption, same as WhatsApp. Slide. So for the workflow for our community was the dentist could post public health messages on the community group. This was only limited to the admins. The other members could not post, cannot post anything, but they can directly message to the admins. And through this community group, we posted oral health education, posters, oral hygiene advice, and we promoted oral health events in this community group. Next slide. So as you can see, all other members, only the admins can message and write on the community group. All other members, they did not have the privilege to put anything in the community group. So that actually kept the community group clean with only oral health education messages. Important. Next slide. So this is basically how patients can message to the admins for any health advice or to get triage done during the pandemic. Next slide. And workflow for patient to dentist is where patient can message to the admin, and then we take history taking and consent through the Google Forms, and then after that we can either do synchronous communication through chat, video call, or audio call. Depends on how patient prefers. And then in that way, we can triage them or manage their pain or basically provide whatever management they need. We are not actually treating patients through this platform. It's just management or triage. Next slide. So this is basically our workflow during the pandemic. So if the patient needed an emergency or urgent treatment, we provided an appointment to come to the dental clinic. And if at that point in time, we were only doing non-aerosol generating procedures, because there were concerns about aerosol generating treatment, and COVID-19. And if patient needed a referral to specialist or medical clearance, we sorted that out before patient came to the dental clinic. So in that way, it made the patient's workflow easier, and they had less movement during this peak period of pandemic. And at that time, we were not really doing elective or non-urgent treatment. So for those cases, we provided therapeutic treatment, and we deferred treatment until restriction lifted. Right now, we are not deferring treatment, but we do provide appointments for patients who need non-urgent and elective treatment. Next slide. So this is a workflow for specialist consultation, especially for oral surgery. So we have a divisional Viber group to discuss cases on oral surgery cases. So we forward patient details, medical history, and assessment to specialists after we get informed consent from the patient. As long as patient is aware that we are sharing information and we do take patient consent, then we are within the laws, policy, and it's regulated. It's in our regulation. And after that, we provide a referral letter, and patient are either if it's an emergency case, they are taken through ambulance. If it's a non-urgent, such as pathology, or maybe they need surgical removal of an impacted tooth, we give them a referral letter. Next slide. and this is a referral for a medical clearance to get medical clearance for certain medical conditions the patient have. The patients can get the clearance from their nearest health center before they arrive at the clinic. And this is an electronic prescription that we send out to pharmacists so that the patients can go to the pharmacy and get the medications. We do not have any applications right now for electronic prescription, so we are basically using a PDF. Make a PDF file and use the PDF file to as an e-prescription. And our appointments, we saved it in our Google Calendar, and this was shared among the dentists in the clinic. So everyone to the calendar and knew which slots are full and which slots are open for, so that they can give appointments to patients. And this was our monitoring and evaluation. We used an Excel sheet to record all data, and this was how we gathered statistics and how we can improve the service and for future development. Some of the examples. So this was I think it was a 28-year-old male who presented with swollen gums and complained that some of his fragments from his molar tooth were breaking off, and he was in a lot of pain. This was around 3:30 p.m. So almost the closing time of our clinic. We close at 4:30. So we asked him how long will it take to come to the clinic. So he said that he's going to be there in 30 to 40 minutes. So he arrived at the clinic. We did an assessment. We can do that. We can see in the picture that it's a lower left third molar. It doesn't look impacted. So we prepared the tray for extraction. And when he arrived at the clinic, we did our vitality testing. We took X-rays, and then we completed the treatment within probably around within 20 minutes. It was a simple extraction, and it did help the patient since he was not able to sleep for quite a few days. This is another patient who actually we did a monitoring of how he's doing after they had pericoronitis. So we prescribed antibiotics and painkillers, and we reviewed through the platform on how they are doing, and we advised them to come back for a review. This was another one where we sent an e-prescription to a dispensary and patient lived quite far, around 30 to 40 minutes away from the main hospital. So we sent a prescription to a dispensary, and patient was able to pick up their medications from the dispensary. So at this point in time, it was like really peak time of COVID-19, and patient was symptomatic, and he had pericoronitis. So we gave prescription um, that he was able to pick up from the dispensary. This was a very interesting case and quite quite close, quite personal for me, because the patient was a 60-year-old female, and presented with Plaza for 2 weeks. So the the patient was actually a mother of one of, so that's why it was advised that if I can do the workup for him, since the bed was actually like there was a bed block in hospital. We did a workup, we did a biopsy, CT scans for the patient, and the patient was referred after we got the result. Right now, the patient is doing well. They are on, actually, patient went to India to get radiotherapy treatment, since we do not have radiotherapy in Fiji, and they are doing quite well now. This is another patient where we did as of a third molar. It wasn't. It was slightly impacted. We did have to. We had to do a bit of root recovery to get the tooth out, and the patient complained of Christmas and slight cellulitis. And we monitored through this platform for 3 days, and the patient really appreciated that there was someone who was actually reviewing and could follow up for her. Next slide. This is another 2-year patient. The patient had incipient caries and had cellulitis on the right side to the canine space and infraorbital region. The parent did not want to admit the patient, so we actually made, since the patient, parent did not want to admit, we had to look for an alternative. So we gave oral medications and some IM antibiotics as well, intramuscular. So the patient did come to the hospital daily and got their vitals checked, and we were also able to review through this teledentistry platform daily. Next slide. Some of the outcomes and statistics are that the peak period of our pandemic were during June and July. That's why we had a lot of engagement during this period. And from August, during August and September, our borders and a lot of restrictions started opening up. So patients started coming in directly to the clinic. Most of the patients were around 18 to 29 years of age. And yeah, it mostly consisted around this age. So the way forward for this is that this is a working concept that we currently have, and this can be adapted into telemedicine as an emergency or rapid implementation. But as a long term, we do need a more secure platform to have a sustainable teledentistry and telehealth telemedicine platform. A similar concept of workflow can be adapted during emergency operations, and of course we need to provide training on the laws, regulation, and policies around this. Different countries will have different policies and regulations, so maybe this will work in some countries, maybe some countries may not allow this. And everything around the world is now turning into digital workflow, so we are moving into the digital age in everything. So teledentistry will evolve from this first concept, and all efforts should be made to document all processes, divergences, convergences, and synergies to strengthen this innovation. Monitored and took feedbacks from patients on how they feel about this concept. It was something new that was done in Fiji, and we did have to encourage and go through a lot of channels to get this approved. So this is something I found in, hold on, it was actually from National Network of Oral Health Access. It's a US publication, and it's something that something interesting where it gives oral health equity to everyone through teledentistry, where people have access to oral health wherever they are. Thank you, everyone.